And away from politics, Health Cabinet Secretary Mutahi Kagwe says the country has begun to flatten the Covid-19 curve following the drop of positivity rate to below 5% in the last 3 weeks. Now, he, however, warned of a second wave if Kenyans drop their guard and fail to adhere to the guidelines. Now, this comes as the latest statistics show that 130 people tested positive for the virus from a sample of 3,874 in the last 24 hours.
Since the onset of the COVID-19 pandemic in Kenya, the number of confirmed cases has been on a steady rise, as well as the number of lives lost as a result of the pandemic. However, the Ministry of Health is now reporting a steady decline in the number of positive cases for the last 21 days, amid rising hopes the country is on its way to flattening the curve.
We have noticed over the last couple of days, in the course of this month, that except for a couple of days, we have been on a positivity rate of below 5%. The World Health Organization proposes that when you can run a below 5% positivity rate for over 14 days, heading for 21 days, then as a nation, you have begun to flatten the curve.
Health CS Mutahi Kagwe says it is not time to celebrate just yet.
However, let me caution that even as we do so, events elsewhere across the globe indicate a new wave of COVID-19 cases. And we have no choice but to be cautious for that second wave that is always a possibility.
But as Waziri has said, we should not throw caution to the wind because we can easily reverse in terms of the progress that we have made, as has been witnessed in the continental Europe, where now there's a resurgence of the cases and they're now reimposing strict containment measures.
According to World Health Organization, before a country considers lifting restrictions, it should ensure there's a decline in cases by 50% over a period of 3 weeks where testing is optimal, less than 5% positivity rate over a period of 2 weeks, decline in the number of deaths among confirmed cases, and a decline in hospitalization.
If you look at the past 21 days or so, our average has been less than 5%, despite a few blips, like 1 or 2 days ago when you had more than 6.8%. But we don't take that alone into consideration. We also look at the number of patients who are admitted for institutional care. And as of today, we have just about 484 patients in all health facilities with COVID-19 disease, from a high of more than 1,200 cases 1 or 2 months ago. We also look at the number of cases who are on critical care. As of today, we only have 14 people in ICU under critical care, 4 of them with ventilatory support, the remaining 10% on supplemental oxygen.
Kagwe, who was speaking at Kenyatta University Teaching and Referral Hospital after a consultative meeting with the Council of Governors on Cancer Management, said that 130 people tested positive for the virus out of 3,874 samples tested, increasing the total corona burden to 37,348. The number of recoveries rose to 24,253 after 106 patients were discharged, out of which 25 were from the home-based care program and 81 from various health facilities. The number of fatalities also increased to 664 after 5 people succumbed. For Channel 1 News, I am Emily K. Buddy.